Hi, I'm Dr. Jeff Fialkov, and I'd like to talk to you about the different types of rhinoplasty. There are a number of different types of rhinoplasty surgeries that can be performed to correct the shape and size of your nose. Most of the time, people choose to have rhinoplasty performed because they're unhappy with the look of their nose. Other times, people need to have the surgery performed because of trauma or for a medical reason, such as impaired breathing. Let's go over some of the most common types of rhinoplasties that can be performed. Remember, when your surgeon chooses the type that is right for you, he or she must take into consideration your expectations, your desires, and the limitations of your particular situation. First, there's an augmentation rhinoplasty. This form of rhinoplasty is performed to help enhance the size of the nose. Often, the reason behind this type of surgery is that a patient has a desire to have a larger and more even-looking, more symmetrical nose. Some of the causes of a small nose include genetics, injuries, or other surgeries that may not have been performed correctly. Number 2, reduction rhinoplasty. A reduction rhinoplasty is performed when a patient is unhappy with the size of their nose, and they find that it is not aligned correctly or is disproportionately large compared to the rest of their facial features. Typically, reduction rhinoplasty will reduce the size of the nose and reshape it to make it more even and symmetrical. Typically, patients seeking out this type of procedure are unhappy with the size of the bridge of their nose. They have a bump on the bridge, or their nostrils and tip are too wide for their liking. Number 3, post-traumatic rhinoplasty. When an injury occurs to the nose, it can become quite misshapen, asymmetrical, or it may lead to other types of damage that result in the patient not being happy. When this happens, your surgeon may term the rhinoplasty a post-traumatic or reconstructive rhinoplasty, which will change the appearance of your nose, help reconstruct it to look normal and proportionate, and improve breathing. Sometimes, rhinoplasty needs to be performed after an injury because the airways become blocked, or there is a deviation in the nasal septum that causes pain, distortion, or other problems. Number 4, ethnic rhinoplasty. Ethnic rhinoplasty refers to making a rhinoplasty suit your ethnicity. This principle is important and requires an experienced surgeon because a surgeon must be able to match all ethnic characteristics of the nose and the surrounding area of the face. If you're looking to have a rhinoplasty procedure in keeping with your ethnic origins performed, it's advised that you choose a surgeon who has extensive experience in this procedure. Now, why choose rhinoplasty? Patients choose to have rhinoplasty performed for a number of different reasons. Some of the most common reasons include a crooked nose, a large or small nose, a depressed bridge of the nose, a wide nose, either the bridge or the tip, a nose that's too long, or nostrils that are too wide. Now, there can be issues with the tip of the nose specifically, like a bulbous tip, wide, asymmetrical, or droopy tip. These problems can all be addressed with rhinoplasty. The type of procedure that's right for you will depend on what you want to get out of the surgery itself, and of course your expectations for the appearance. If you're interested in having rhinoplasty performed, contact us at Edelstein Cosmetic today. Thanks for watching.